Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2 meters distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2 meter distance from others. I will now report our current case counts. There are 136,659 confirmed cases of COVID-19 in Canada and 44,504 cases in Ontario. Chatham-Kent has 364 cases and Sarnia-Lambton has reported 342 cases. Michigan now has 111,524 cases with 13,991 cases being in Detroit. Today we are reporting 2,594 cases of COVID-19, an increase of 4 new cases from yesterday. All 4 are close contacts of confirmed cases. 2,427 cases are now resolved and 91 cases are active and being followed by our health unit. 1 person is in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There are 3 retirement homes currently experiencing a COVID-19 outbreak. With the return of students to school, we would like to assure you that our health unit continues to work with all school boards and principals. If a case of COVID is confirmed in a student, protocols are in place to communicate with the principal through their assigned school nurse. In addition, our nurses at the health unit will manage the case and contact management aspect of the work. Remember to stay home if you are sick. Parents should continue to do daily symptom checks before sending their child to school. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Please check our website for information for parents and caregivers as children return to school. We have prepared guidance for both elementary and high school students, including a quick symptom checklist to help you determine if your child should remain home due to illness. To access an assessment and testing center, there are several options in Windsor-Essex County. Erie Shores Healthcare in Leamington, Windsor Regional Hospital Olette Campus, and the Sportsplex at St. Clair College. And SOHAC in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again for the Monday morning. Since the beginning of this COVID-19 pandemic, the staff at Windsor-Essex County Health Unit has worked tirelessly to protect and promote the health and well-being of our community. And I want to continue to thank my staff for their dedication and commitment to serve their community and make things happen when it's needed. The pandemic really brought public health to the forefront based on their critical role of protecting and promoting the health of our community. Most of the public health work is defined under the Health Protection and Promotion Act. The Ontario Public Health Standards outline the minimum expectation and requirements for public health unit services and operations across the province. The standards include guidance documents and protocols on all requirements under the Ontario Public Health Standards. From a health system perspective, public health is tasked to ensure good case and contact management and containment of any outbreak in the community, workplaces, long-term care homes, retirement home, and other congregate living settings for COVID-19. Just like an individual living in our area, it is our responsibility to take precaution to prevent any outbreak. Every workplace, every long-term care homes, retirement home, and other congregate living settings are responsible for following the guidance issued to them through public health, municipality, or through their regulatory authority. The task on hand is huge, and we all have to take ownership of our own responsibilities and do our part in reducing the spread of COVID-19 in our community. Our efforts and energy should be directed more towards prevention, because in many settings, once the case starts to spread, it is very difficult and takes much more effort to contain it, and some individuals end up in hospital, and even worse, few die. It is important for everyone to recognize that it is not public health job or the hospital's job or the municipality's job or the province job to do the work that you are responsible to do. As we see cases rising in other parts of the province, we need to be prepared. We need to be ready. The best time to act is now. I would encourage everyone, starting from individuals in the community, to develop a plan, how they want to socialize, how they will attend their workplace, how they will travel, what are some of the things that they need to think proactively to protect themselves. For example, as an individual, ensuring that they have a plan to monitor their symptoms, plan to reduce the number of contacts, maintain physical distancing, wear cloth masks in areas where physical distancing is not possible. If some of these individuals are going to public settings, what plan they need, what time they want to go to avoid large groups, how they will touch the surfaces and clean the hands before and after. For workplaces, they also need to plan for their employees, ensuring that they are maintaining their workplace as per occupational health and safety requirements, as well as the local public health guidance. I would urge all the workplaces to review your plans if you haven't done it already. Develop training and educational for your staff to go through. Ensure active screening practices for your employees. Environmental cleaning, including measures to ensure physical distancing to maintain at your workplace, is active and initiated at all times. In addition, it is also critical for the workplaces to have a contingency plan. If there is any outbreak, how you will maintain your operation when employees are excluded from work. The efforts of prevention now, before you have a case, will save individuals as well as businesses and facilities a lot of trouble by not having an outbreak. We have a number of guidance documents available on our website. Please visit them at www.wechu.org. With more individuals going back to the workplaces and increased physical contact, the risk for COVID-19 transmission increases. We'll continue to work with the community to provide most up-to-date data and guidance for our region. And this will never get old, so I would like to remind everyone to have good infection prevention practices in your workplace, including regular cleaning and disinfection, policies related to hand hygiene and respiratory etiquette, screening for COVID-19 related symptoms, and illness among employees and visitors. Sick policies to ensure ill workers are supported to stay home, policies and practices that support physical distancing, and policies related to personal protective equipment as appropriate. For more guidance and information for workplaces and for other sectors, please visit the Windsor-Essex County Health Unit's dedicated webpage for workplaces and other businesses to get the more up-to-date guidance on all of these areas. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CBC.
Nothing for me today, thank you.
AM 800.
Doctor, on that Saturday, there were 4 cases due to close contacts. I believe 6 yesterday and the additional 4 today. Are those related to the cluster? Has the 37 number you told us last week, has that increased?
Well, I can tell you is one of them is a part of that cluster, and the other are, we haven't linked it specifically to a cluster right now, but we are looking and trying to put all the information together to see if there's anything else that's going on in the community that we can connect all these dots to.
Would that be an additional cluster, or that would be from the original cluster?
So the contacts that we are looking right now, they're not part of the cluster that we reported, but there are some pockets of individuals that we are looking at and exploring the possibility that if they're all linked to specific events that we can attach them, but that work is currently ongoing. I cannot say that if there's a new cluster or if there's not a cluster, that work is right now happening.
Just to clarify, the 37 is now 38?
You can say that, but we will release our epi summary for that cluster at a later time. But yes, you can say that 37 would be now 38.
Okay, thank you.
Any questions from Blackburn?
Nothing for me today, thank you.
Windsor Star?
Yes, good morning, Dr. Ahmed. With today's messaging, are you just seeing more people going back to work, maybe people not understanding what their role is at the moment?
Well, it's a bit of both. I think what we like to emphasize now is it is time. I think when things are in a chaos and when a lot of things are happening, it's very difficult to plan. It's very difficult to do some of these proactive measures. What I was trying to give is it is time that we should think about our plans as individuals, as families, as workplaces, as businesses, everyone. Sit down and think what you need to do to ensure that you can continue to keep yourself safe. You can continue to run your business the way you like to, and you can continue to keep all those economic activities going on in the community. As the cases are rising in other parts of the province, there's a fear that if the cases go up to that higher level, what would happen, whether we have to go scale back our activities, whether we will go back to stage 2, stage 1, or maybe a complete lockdown, who knows? So I think if we take actions right now, that's the only way we can protect it. Once it starts to spread, it would be very difficult for anyone to contain, whether within a single workplace, whether in the community. We have this opportunity. I think our community has done an excellent job in keeping the numbers low, and the opportunity for us is right now to be that community, be that leadership, to take charge of our own actions, everything that we are doing right now before everything starts to get into a chaos with more cases like other places. So the message is, right now is the time. Invest more on the prevention before a case happens. If something happens and then you're putting in effort, it's already too late. So focus now on the prevention piece, and that's the only way we can move forward.
Thank you.
Any questions from Windsor?
Good morning, Dr. Ahmed. This morning you thanked the health unit staff, and since it's been about 6 months since everything kind of got pretty crazy for you, you folks at the health unit, I just wondered, what's the morale like among staff, and how have you, Teresa, Mike, Jen, and everyone else at the health unit been coping through this time?
So I'll let Teresa respond to it, because she's the one who is dealing with all of these issues, and also providing regular update and connecting with the staff on all of these issues. So over to Teresa.
Well, I have to say our staff have been very resilient, adaptable, flexible, and patient. We have made many changes as the pandemic and the needs of our community changed throughout this pandemic, and the priorities. The staff were able to adapt quickly. We've made a lot of scheduling changes and changes to groups of people working together, working from home. We created a whole e-charting mechanism to allow this. These are things we never had pre-COVID. So our staff have been impressive, amazing. I can't say enough good things about each and every one of them. We have so many disciplines working, from health inspectors, nurses, tobacco and enforcement officers, our clerical staff, dental. As you said, Mike, communications, our epidemiologists are working around the clock, everybody. Many people are working from home, and so I don't see them face to face. I know our managers are the direct links, and I think people are doing the best they can. It's been incredible, but the staff have been really resilient and very patient with all of our changes, and continue to move forward through this. So I'm just proud of what they've done and the contributions to our community during this time.
Well, thank you. We appreciate your commitment.
Any further questions from CBC?
No, thank you.
AM 800?
Teresa, with going back to school, like you mentioned, I know that you are in talks, and the health unit's in talks with the hospital. Are you both anticipating maybe an increase in people getting tested at the assessment centers in Windsor-Essex?
So we have the direction for people that need testing in the school setting will be to attend an assessment center, and there are assessment centers available. And that has been the communication with the hospitals, that if single cases increase where there's more a need for broader testing, we'll work together to make sure that happens, whether it be at an assessment center or in another location. But we do have the ongoing dialogue with the hospital to, monitor the needs and quickly change if we need to expand.
Dr. Ahmed, sorry, going back to the community cases. So I just want to make sure I have it right. Is there a second investigation underway to a possible cluster, or your team's looking at the possibilities with the numbers going up in the close contacts?
Yes, so every time when we are collecting that information through our case and contact management, we try to put together and link each of these cases with other individuals. And the idea behind is the same, that if they're all of these individuals are tied to specific events. So I think that's currently being explored. The numbers are definitely something that we are keeping a close eye on to see if they are indeed part of a cluster or maybe just one single event. So right now that work is ongoing, and the number of close contacts that we have received over the weekend and some in last week, we're trying to piece it all together to paint the picture and see if there is any cluster at this time. But right now it's a question mark, and we'll provide more details when we have more information to say with certainty that they are all part of a cluster or some event that happened, and then what are the next steps as a result of that event.
Thank you. And just a request for tomorrow, Teresa, any way we can get the enforcement numbers again, just an update. I think it's been about 2-3 weeks now. If we get another update.
Sure, that sounds good.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
You mentioned last week that you'd be providing an update on the mask mandate for the entire region. Is that coming tomorrow? Just curious.
Sure. Yeah. Tomorrow I'll share the more specifics. But as I said, it's nothing different, nothing unique. And we were just ensuring some of the language that require updating is accurate. So we will share that information tomorrow.
Okay, great. Thank you.
Any further questions from Windsor?
No, thank you.
Thank you, everyone.
Yep.